This video provides information on genetic testing for inherited heart conditions. These include some heart muscle diseases called cardiomyopathy and certain heart rhythm problems which may have a genetic cause. Your healthcare provider has suggested this test to look for a cause for your or your child's heart problem. This video will cover what genetic testing is, what results you can expect from this test, and limitations to genetic testing. First, let's review some basic genetics. At the center of each cell in your body is your genetic information. This is called DNA. A gene is a section of DNA that works as an instruction to tell your body how to develop and function. Like a recipe gives instructions for how to make cookies, or a blueprint gives instructions for how to build a house. You have 2 copies of almost every gene. One copy comes from the egg and one from the sperm that formed you. There are hundreds of genes that we know are important for heart health. With genetic testing, we are reading through many genes, similar to reading through many books in a library. We read through each book to see if there are any misspelled, extra, or missing words that cause the book to not be understood. In the same way, we read through each gene to see if there are any differences that may disrupt the gene and cause health concerns. We call these differences variants. Genetic testing can give several types of results: positive, negative, uncertain, or complex. A positive result means that a genetic cause or variant is found that explains your or your child's heart condition. In rare cases, knowing the genetic cause can lead to a specific treatment, such as a new medication or device. More commonly, a positive result does not change how your doctor looks after you, but may still be helpful information for you and your cardiologist. When a positive result is seen, biological family members are eligible for genetic testing. Relatives who test positive for the variant can be monitored by a heart doctor. Relatives who test negative for the variant do not typically need to have ongoing heart monitoring. Talking with a genetic counselor can be helpful to decide if genetic testing is right for them. A second possibility is that your test does not find anything. This is called a negative or uninformative result, meaning that in the genes tested, no variants are found. This does not change your diagnosis, as this is based on what doctors see on your heart tests. It is possible that a genetic cause is still present, but the test was unable to find it. The third possibility is an uncertain result. This means a genetic variant is seen that is not well understood. It may or may not explain your heart condition. Your healthcare team will discuss with you possible next steps to try to better understand this result. Finally, and rarely, genetic testing can identify other types of results, such as a complex result, where more than one genetic variant is seen. Your genetic result may also identify a syndrome. A syndrome is a collection of health concerns due to the same cause. Further evaluation or referral to other specialists may be suggested in these cases. It is important to know that genetic testing has limitations. That is, there are some genetic variants that are not found by this test. Although our understanding of genetics is growing every day, there are limitations to what we know at this time. Genetic testing is done by a regular blood draw at your local clinic. There is no cost to you for this test. As the testing is highly specialized, the results may take several months to come back. In summary, genetic testing is available to you to help understand the cause of your heart problem. If a cause is found, then genetic testing can be a helpful screening tool for your family. If you have any questions about this test, please talk to your healthcare team.